So the Accelerated Access Collaborative is an umbrella organisation that brings together different organisations across the research and innovation ecosystem. So, for example, the AHSN network, but equally organisations like NICE, the NHS, the National Institute for Health and Care Research, MHRA, and industry partners as well as patient partners. So a real diversity, but equally a really powerful collaboration. So what we do is we bring together that collective expertise and power of having those organisations working together to think about how we can make it easier and what each individual organisation can do, and actually where we are greater than the sum of our parts when we work together to enable us to get those innovations into the hands of clinicians and patients more quickly. We also have individual programmes of support that support individual innovators or individual products, and one of those really new exciting products and programmes that we've got is the new NHS Innovation Service, which actually offers a bespoke coordinated support offer to innovators so they actually get support and contact with those organisations that are part of the Accelerated Access Collaborative to make sure they are doing what they need to do to enable them to work with those organisations to get their innovation to the NHS. There's always been a huge amount of energy across those organisations, but I think actually the pandemic has really galvanised that, because we've seen the power of what actually can be done when people have one target in mind and they can actually come together in a way that they can provide a solution to something that really makes a difference to people. So I think we really are still harnessing that energy from the pandemic, and also harnessing the understanding of what we can do when we all work together towards a common cause. We can draw on the experience that we had from working across the pandemic or in the acute phase, thinking about virtual wards, digital access, and now allowing patients to do things differently that work for them, that actually also enable things to be done more efficiently within the NHS. So it's really urgent that we do this now. We have got a significant pressure on the NHS, and we really need to come together and work as we did during the pandemic to really address those issues and to support the NHS, as well as harnessing the absolute energy of industry at the moment and our innovators to make a difference for patients in the NHS.